Welcome to our comprehensive guide on anticoagulation therapy. In this video, we will explore the various anticoagulants, their benefits, challenges, and patient-specific considerations. Warfarin is a commonly used anticoagulant. Patients best treated with warfarin include those with good control, renal failure, mechanical heart valves, gastrointestinal disease, and poor compliance. Patients with good control on warfarin may not benefit from switching to dabigatran due to the risk of non-hemorrhagic side effects and the need for twice-daily dosing. A recent trial demonstrated that reducing INR monitoring frequency for stable warfarin patients is non-inferior for maintaining therapeutic range, reducing the inconvenience of warfarin treatment. Warfarin remains the preferred treatment for patients with severe renal failure, as these patients were excluded from trials for dabigatran and rivaroxaban. Dabigatran is contraindicated for patients with mechanical heart valves, as it has not been evaluated in this population and carries an FDA warning. Patients with gastrointestinal disease and elderly patients are at increased risk of GI bleeding with dabigatran and rivaroxaban compared to warfarin. In the RE-LY trial, gastrointestinal distress was a common reason for discontinuation of dabigatran, affecting over 11% of patients. Patients with poor compliance to warfarin treatment are not suitable candidates for dabigatran due to its twice-daily dosing and short half-life. INR monitoring for warfarin-treated patients helps ensure compliance and allows clinicians to take aggressive measures if levels are inadequate. The cost of novel anticoagulants is significantly higher than warfarin, which can impact patient compliance and accessibility. Patients best treated with newer anticoagulants include those with poor warfarin control, unavoidable drug interactions, and new patients on anticoagulation therapy for atrial fibrillation. For patients with variable INR results, dabigatran offers lower rates of stroke and complications, but non-compliance must be ruled out first. New anticoagulants are beneficial for patients with unavoidable drug-drug interactions, such as those on antibiotics, chemotherapy, or multiple medications. Warfarin-naive patients may benefit from newer anticoagulants to avoid frequent dose adjustments, but informed decision-making is crucial. In summary, warfarin remains a viable option for many patients, while newer anticoagulants offer benefits for specific groups. Consider patient-specific factors when choosing therapy. Here are some key references for further reading on anticoagulation therapy, including studies on warfarin and newer agents. The FDA has approved several new anticoagulants, including Eliquis, which have been compared to warfarin in various studies. Now let's test your knowledge with a quiz on anticoagulation therapy. Answer the following questions to see how much you've learned. Question 1. Warfarin-induced osteoporosis, all true, except A. Occurs after long-term use. B. More common in females, see 60% increased risk of osteoporosis-related fracture. D. B blockers may protect against osteoporotic fractures.